Assalamu alaikum. I'm Mushtaba Hassan Askari of Helping Hand Foundation. It's 26th February. It's about noon time, and we're just a couple of days short of the month of Ramzan starting. We are at the Shaheen Nagar MP clinic. This clinic was, rather, the health center was established about 4 years back. Let me just give you a brief background. This area is one of the largest peri-urban slums in Hyderabad. The majority of the population here are migrant laborers. Housing is very cheap, and they are mostly daily wage earners. We have been consistently seeing for the last 4 years that this center at an average is serving 500 and above outpatients per day. This center is unique because we have integrated a lot of universal healthcare components into the service delivery. We have the promotive health, preventive, curative, rehabilitative components very tightly integrated at the primary care level. Now, in terms of services, we have community dentistry here, we have vision care, we have a program for prevention control of NCDs, we have lactation management centers, lactating mothers, and postnatal care. We have a mini operation theatre, and then we have the doctors from various background, gynec, diabetes specialist, pediatrician, and a general physician, and an ER physician around. Now, this center has been a watershed movement for this area. Another very important development at the Shaheen Nagar center is that we have recently introduced health app from a company, US-based startup called MyDoc. This is an AI-based health app which is in the process of being implemented and being rolled out. All the doctors have now got access to the app. The entire medical records, we're trying to make it electronic, which is going to be EMR. So right now the implementation training is going on, and all doctors will have a system at the table. They will use this app to basically record the patient's grievances. It will have the entire history, chatbots, and all the AI-enabled features, and this will hopefully in due course improve efficiency, productivity, and save time, and help doctors do better clinical diagnosis and treatment. I'll just read out the statistics for the year 2024 that will give you an idea, but one thing is for sure that it has transformed lives here. The mortality in this area has significantly reduced. I don't have numbers to share. There's considerable reduction in morbidity. We are able to catch disease early and treat them, and lastly, we have a very strong referral pathway to the tertiary centers because Helping Hand Foundation works in the government, so we have a very robust pathway to the referrals. The end-to-end experience of the patient is absolutely free of cost of treatment, high quality free treatment. So now in terms of statistics, we have seen 1,12,799 patients footfall in this Shaheen Nagar center of MP. We had 52,209 patients with primary health issues. More than half of this were infectious diseases because this area is highly vulnerable in terms of hygiene, sanitation, open drains. So a lot of diseases like dengue, enteric fever, we even had cases of cholera are endemic to this area. Then we have 12,830 NCD patients, mainly diabetics, hypertensives, patients suffering with thyroid problems and other chronic health issues. 7,760 antenatal, postnatal, and reproductive health patients were seen. Ophthalmology saw 4,762. We're doing basic refractive error checking and other vision impairments we're checking. Cataracts, we are linking them to our the government hospital for treatment. We had 3,483 patients seek dental care. So totally 1,12,779. Physiotherapy saw 5,101 patients. Again, this is a very unique service which we have introduced here, and this is again fits into the preventive component. We are saving a lot of people from laminectomies and other surgeries. The mini operation theatre is again something very significant. 7,188 patients, and the IP ward, which you see right behind me, catered to 754 patients. This ward is basically a short stay, the day center, plus was designed to treat tropical diseases which are endemic to this area. 754 patients utilize the services absolutely free of cost. We believe this alone has saved about 1.88 crores worth of out-of-pocket expenses of the patients. In sum, all these interventions for over a lakh of patients in the course of the year, we believe has at least saved about 9 crores worth of out-of-pocket expenses, with little above $2 million. So obviously, with this kind of impact, there has been a transformation. The social indices, our data and survey are showing of the people around this clinic has changed. They're saving money, which is very critical. They're able to spend money on the children's education, tuition, better nutrition. There's much more financial stability. And I thank AMPI from the bottom of the heart for supporting this endeavor, and we look forward to your continued support. Assalamu alaikum. Jazakallah khair.